Have you been told that you have hip arthritis and that there's nothing that you can do about it? Well, today we're going to change that stereotype and show you ways that you can start gaining more hip range of motion, more hip capability, so you don't have to keep sitting on the couch worrying if this pain is going to get worse and worse over the course of time. Now, I want to start this video off by saying that yes, indeed, some people do need to have hip surgery. It is not unavoidable for everybody, but a lot of people take the easy way out, and once they see that they have arthritis on their x-ray, they just assume that there's nothing that they can do about it, which is totally false. In fact, many people who are fully healthy who have no hip pain at all have arthritis on their images. They've done studies of this over and over again on healthy individuals who do not report pain. Anybody over the age of 30 is going to start having increasing risks or increasing findings that are quote-unquote diagnosed of arthritis in various different joints, from their low back to their knee to their hip. But again, these are non-painful individuals. They are asymptomatic. So is arthritis really the sole culprit of somebody's pain? Or is it just a stiffness, tightness about your tendons, or a lack of capability or capacity in those tissues to tolerate stress or workload? Now, if you want to sit on the sidelines and do nothing, then yeah, be a slave to what your image is saying. Or you can actually try to do something about it, try to do something to improve your circumstances, get better, and then worst case scenario, if it doesn't help, then you could seek further consultation with something more significant, such as an orthopedic surgeon, to discuss your options. Now, I am a physical therapist. I have my doctorate in physical therapy, but by no means is this video saying that you should be doing this. I have no idea. I've never seen you move. I've never done an assessment on you. So utilize these suggestions as just general guidelines of different options that you could do, but without having an assessment on you or working with you directly online or in person, I have no idea if this is the right thing for you to do. So take these options with a grain of salt. Proceed with caution, especially if you are dealing with a lot of pain currently. Now, your hip is very capable of a lot of different directions. We're going to focus in on 4 of those directions because I find them to tend to be the most comfortable to be working on, with less chance of causing a flare-up. But again, I have no idea of what your hip range of motion capabilities are, so you need to be cautious if you are going to try any of these, or consult directly with a trusted healthcare provider before starting any of these exercises. So in the name of caution, we are going to stick with the simplest exercise first, which is, I call them child rockers. You're going to be on your hands and knees, and you're going to sit your butt back towards the heel as far as you feel comfortable going, trying to keep your spine in a relatively neutral or straight position. Basically, if you imagine yourself having a tail, you don't want to see your tail tuck under, and you don't want to see your spine just globally round as you do this exercise. Now, I realize some of you may also have knee issues, so if that is the case, make sure you have a nice piece of padding that is on the ground, and you don't necessarily have to sit all the way back. Just sit as far back as you currently feel comfortable, but it's going to be a fairly intense stretch. You just want to be sure that anything that you sense or feel, you only go through the range of motion you feel confident in going through, and then make sure all of that sensation goes away and you return back to your baseline level of how you feel after doing the exercise. Nothing should linger, nothing should stay worse. With all of these positions, we're going to try to accumulate 3 minutes total in every position, and you can break that up however you want to. You could do a circuit of all these exercises and just do them for 10 seconds and just keep rotating through, or you could sit in each of these positions for a minute and then rotate through the circuit 3 times through. Goal, again, is to get 3 minutes cumulative in every one of these positions. This exercise in general helps with hip flexion, or the ability to bring your knee towards your chest. Next up, we're going to get a cross-legged toe touch. This exercise is going to work a little bit of hip internal rotation as you cross your leg behind you, forward fold down towards the floor, and hang out in that bottom position for as long as you feel comfortable. Again, 10 seconds at a minimum, working up to a minute at maximum, trying to get 3 minutes total accumulation in this position, and then do it on both sides. This is another great exercise for improving that hip flexion, but again, also working what we call hip internal rotation. Sidebar, if you've gone through the last 2 exercises and you can take your butt all the way to your heels, and then you can touch the floor fully in this forward fold position, hip arthritis probably isn't what's causing your pain if you're dealing with pain. You should be probably focusing more on strengthening your hip, or you're looking in the wrong place, because the body, again, is a chain. Perhaps you're experiencing pain in the nerve root that's causing pain down the leg and causing you to experience pain elsewhere. Again, this video is not diagnostic in any way, shape, or form. You should have a consultation with a trusted healthcare provider to help direct you in the proper way. I'm just saying, if these two exercises that we just did previously were no issue whatsoever and you have full range of motion, it's not adding up to true arthritic type findings. It doesn't mean it couldn't be. I'm just saying it's not adding up right now. Now, the third exercise we're going to go through is what we call a couch stretch. Many people probably have seen this stretch before. It works on hip extension or quad flexibility. Your goal, trying to get your butt as close to your heel as you can while keeping an upright torso. Feel a stretch go through your quad all the way up to really kind of the bottom of the abdomen. Now, depending on your current flexibility status, you might not be able to go through that full range of motion, so just go through the range of motion you currently feel comfortable. And again, use a cushion or a pad down at the bottom if you need to, if you're having some type of kneeling pain in the knee. And then finally, we're going to do an exercise that we call a shark tail. This works on hip rotation again, but really we're thinking about rotating the pelvis over top of the fixed femur. The femur is fixated to the ground because, again, we're going to be kneeling on that knee. Keep as much shin contact to the ground as you possibly can. That will help you feel this in the correct area, which is the back of the butt cheek on the kneeling knee. And then we're going to take support out of our other four limbs so that more and more load goes through the hip. And when you get it right, this exercise is going to not only seem like a stretch, but it'll also seem like you're strengthening the hip in the same time. Again, don't force yourself through pain. If you're dealing with pain, then put more support on the ground with your arms or the back foot. And if this exercise is just painful to get into in the first place, then you probably shouldn't even be doing it. And again, seek help and guidance from a trusted healthcare provider. We're here online if you ever want an online consult with us directly. Again, you can find those links down in the description below, both to our workout plans as well as our online consultation. And finally, just to summarize this video, if you're like, Greg, there's a lot of kneeling exercises. That's great, but kneeling really is not comfortable for my knee whatsoever. Well, we have a knee arthritis video that you can check out. We'll put that link down in the description below too. And maybe it's your knee that you need to focus on building more capacity, more range of motion up first and foremost before you transition up to the hip, because maybe your knee is currently your limiting factor and not your hip. And again, if you're just like, Greg, that's a lot of information, I don't know how to digest all of that, I'd like some help more specifically, more guidance. Again, we have workout programs that give you the full head to tail workout down in the description, where you can also have access to me through an app for communication, or if you'd just like to set up an online consultation with us directly so we can check out some things, give you a little bit more clarity and direction on the path that you need to go, then that link is also down in the description. Be sure to check that out too and set up a time if you'd like.